All right, do you suffer from having a red face even when you're not angry or you're not even hot?
Well, it's actually an issue that a lot of people have, but there's some good news. There's actually some help thanks to laser treatments at Dr. Stanislaw's office.
Absolutely. We went and take a look.
I was always red. I was very self-conscious, and people thought, what's wrong with you? Are you upset? Are you angry? Are you hot? You know, what's the problem? And it's like, nothing. I just, you know, it's just me. It's just the way I am. But it got to the point where I was constantly explaining, you know, I just have a red face and the makeup wouldn't cover it.
Janet Del Tenry of East Granby came to the Stanislaw Plastic Surgery Center in Avon to do something about those broken blood vessels on her face that were affecting her self-confidence. Dr. Stanislaw will use a high-tech pulse dye laser to erase the red on Janet's cheeks.
So you could do this one of two ways, depending on how much the patient wants to endure?
Correct. So one way you can do it where I just make you red and swollen for the day. So the light just passes through the skin, it injures the blood vessels, but it doesn't give you a bruise at all. And it's really just about swollen for one day. The other setting is I can actually give you a bruise, and that bruise is for 10 days.
What are we doing today?
We're just going to do a little red and swollen, no bruising today.
Dr. Stanislaw says most people choose the easier recovery, even if it means more treatments.
We need to put these on?
Correct.
All right.
This is a very bright laser, so you have to protect your eyes. On the count of 3. 1, 2, 3. You okay?
Yep.
The doctor continues moving the laser carefully and precisely across the area of Janet's face that is red.
You can see it's transiently, sometimes it'll turn a little purple, but it'll actually wash out.
How does it feel?
Like I said, like a rubber band snapping.
So
Not that bad.
With this unit, it's got a cooling unit. So if you look closely, there's a burst of cold air that actually chills your skin first. Then the light, a split second later, the light passes through the skin.
He shows me how it feels on my hand.
Okay, it wasn't bad.
The pulse dye laser will get rid of the redness on Janet's cheeks, and it can also be used to treat broken capillaries around the nose or red spots on the body. Dr. Stanislaw will also use it on rosacea if it's not cleared up by creams or antibiotics. It's even safe enough for children.
I have a lot of children who have little spider veins, little capillaries where there's a feeding blood vessel and it spills out and it makes a little red netting. So I treat children for those.
People need to know if they're going to get this done that not all lasers are created equally when they're looking at where they're going to go.
Correct. There's a lot of lasers that have like a single platform and they have different hand pieces. And they might say, oh, we're going to use this handpiece for blood vessels and this handpiece for a brown spot or this handpiece for hair removal. It's a jack of all trades, master of none. It's not that it's really good at blood vessels.
These laser treatments are quick and there's no downtime after. The pulse dye laser has made a world of difference for this wife and mother of 3.
I feel much more confident. I don't have to try to find makeup to put on to go out. I'm not as self-conscious. People aren't questioning me all the time. So I feel better, much better about myself. I wanted to do it for me. You know, after raising children and doing for everyone else, it was my time, my turn, to take care of something that would make me feel better.
That's nice.
Great.
It's a big difference, too.
Absolutely. Janet tells Kara she feels so much more confident now that she's almost finished with her treatments. And over the years, she does have to go back for some touch-ups.
Yeah, and we'll put all the information on betterct.com if you're interested in getting it checked out. Dr. Stanislaw is located in Avon.
All right. We will be back.